I'm Kelsey Boss, Doctor of Physical Therapy and founder of Compleo. Pediatrics and kids are definitely one of my passions. I love getting kids moving. And when a lot of people have met us, since we have lactation and a lot of baby services, they think we just service babies. But pediatric physical therapists actually service 0 through 18 and even on past 18, depending on the presentation of the child. Pediatric physical therapy after that infant stage continues to work on a lot of the same goals. What are your movement milestones? Is it transitioning on and off the toilet? Is it getting in and out of a car? Is it walking or running better? Wherever your child is having a little bit of difficulty meeting their motor needs, we're going to meet you where you are. So we do everything from kiddos learning to walk and working on their mobility, maybe finding ways to be independent with a wheelchair. Once we get into the older pediatrics, one of our biggest focuses is making sure that children have that autonomy and independence, whatever that may look like. It may look different for everyone. Then we also service the orthopedic population. So if your child broke their ankle or broke a bone in sports and is having a hard time getting back in there, we can help get that strength and range of motion back, walking on their toes, coordination, retained reflexes. All of those are things we treat in the pediatric realm. It's really important to have a pediatric therapist and not just an adult therapist, because children are not just little adults. Their bones are still developing, their growth plates are still developing. Whether it's an orthopedic or developmental reason that brings you in, you still need someone who understands the pediatric development cycle. Also, we incorporate games. We can make it really fun for them. I think a lot of parents sometimes watch our sessions and think we're just playing with your kid. And I promise there's a purpose to everything we're doing, but we really want to motivate your children to want to move. We incorporate balance games, movement games, mind games, whatever the kid is interested in, art, puzzles into our sessions. In the pediatric population, we have that same manual focus and that we do in our infant and adult sides here at the clinic. We really need to address underlying alignment and muscle tightness so that we're setting their bodies up for success. So a session is going to look like first, manual interventions, motion assessments, and releases to align their body. And then different than chiropractors or some other professions, once we get that optimal alignment or positioning, we are really well trained in neuromotor retraining, strengthening, and education to use that new alignment. Because if you're not teaching your body how to use it and how to fire it, they're just going to fall back into old habits. So you really need both that manual alignment piece, but you also really need that strong neuromotor retraining piece. And here at Compleo, we do both of those things together to set them up for success, not just the week they're leaving the clinic, but for their future going forward. So if you want a free screen to learn how our doctors of physical therapy can help your child move better and be more independent, click the button on our website, give us a text or a call, and we'll get you set up.